If you've just noticed your very first sign of Sjogrens, that gritty, sandpaper feeling in your eyes, a mouth so dry you can barely swallow a cracker, or a fatigue that sleep doesn't touch, what you do in the next few weeks matters just as much as the symptom itself. Most people make the same mistake. They notice something's off, they Google it at 2 a.m., they convince themselves it's nothing, and then months later they're sitting in a specialist's office wishing they'd acted sooner. That delay is the single biggest reason people end up with more damage, to their eyes, their teeth, their joints, than they needed to have. So in this video I'm walking you through the exact 14 steps to take the moment you notice your first sign, so you catch this early, get the right diagnosis, and protect your quality of life. Run through all 14, because a few of these are steps most people don't find out about until it's too late. I built something specifically not for just tracking and doctor's appointment. It is called Sjogren's Ultimate Symptom Map and Diagnostic Action Plan, and it walks you through exactly which symptoms to track not just for Sjogren but also for MS and RI. Drop symptom map in the comment, and I would send the link for you to access it. 1. Don't panic, but don't dismiss it either. Here's the tricky part about Sjogren's. The first sign is almost never dramatic. It's not a sudden collapse or a sharp pain that sends you to the ER. It's small. It's your eyes feeling like there's sand in them by 3 p.m. It's reaching for water in the middle of a conversation because your mouth suddenly feels like cotton. It's waking up and needing a sip of water before you can even talk. Because it's so subtle, almost everyone brushes it off the first time. I probably just didn't drink enough water yesterday. I've been staring at my screen too much. I'm just tired. And here's the thing, sometimes that's exactly what it is. Dehydration, allergies, screen fatigue, antihistamines, even the weather can all cause temporary dryness. So the goal here isn't to spiral into worry over one dry afternoon. The goal is to stop treating it as a one-off. If it happens once, let it go. If it happens again next week, and then again the week after that, that's not bad luck, that's a pattern, and patterns are exactly what doctors need to see to catch autoimmune conditions early. The biggest mistake I see people make is waiting for the symptom to become bad enough to justify seeing someone. Don't wait for bad. Wait for repeated, and then act. 2. Start a symptom log today, not next week, today. This is the step almost nobody does, and it's the one that makes the biggest difference in how fast you get diagnosed. Open the Notes app on your phone right now, or grab an actual notebook if you're the type who remembers things better on paper, and create a simple running list. Every time you notice something, write down the date, the symptom, and roughly how bad it was on a scale of 1 to 10. Dry eyes today, 6 out of 10, worse in the afternoon. Dry mouth this morning, woke up needing water immediately. Joint ache in my left wrist, mild, went away by lunch. Swollen gland under my jaw, noticed it in the mirror. It doesn't need to be fancy. What it needs to be is consistent. Here's why this matters so much. Sjogren's doesn't show up on a single blood test the way a lot of people assume. It's diagnosed through a pattern of symptoms combined with test results over time. A doctor seeing occasional dry eyes written in your chart from one appointment is far less convincing than a doctor seeing 3 weeks of dated entries showing a consistent, worsening pattern. Your log becomes evidence. It also protects you from something that happens constantly with autoimmune conditions, being told it's probably just stress, or it's probably just aging, and being sent home. A written log makes it much harder to dismiss what you're experiencing, because you're not describing a vague feeling, you're presenting documented data. 3. Book an appointment with your regular doctor first. Don't overthink where to start. A lot of people get stuck here because they don't know which type of doctor to see first, so they just don't book anything. Don't overcomplicate this. Start with whoever you'd normally see for anything else, your GP, your family doctor, your primary care physician. You do not need to diagnose yourself before walking in the door. What you do need to do is walk in prepared. Bring your symptom log. Describe the pattern clearly and calmly. I've been having recurring dry eyes and dry mouth for the last few weeks, along with some fatigue, and I wanted to get it checked out. Then say the words that speed everything up. Could this be Sjogren's syndrome? You'd be surprised how much faster things move when you name the possibility yourself instead of waiting for the doctor to guess. Doctors see hundreds of patients with vague complaints like, "I'm just dry and tired lately," and Sjogren's isn't always the first thing that comes to mind, especially since dryness and fatigue can point to a dozen different causes. Naming it directly puts it on the table as something worth ruling in or out from the very first appointment, rather than after 2 or 3 visits of trial and error. 4. Ask specifically for a referral to a rheumatologist, not just a specialist. This step trips a lot of people up because they assume the eye doctor or the dentist is the specialist who handles this. They are not primarily, anyway. Sjogrens is an autoimmune disease, which means the immune system is mistakenly attacking your own moisture-producing glands, mainly your tear glands and salivary glands, though it can affect other organs too in more advanced cases. The specialist trained to diagnose and manage autoimmune conditions like this is a rheumatologist. Your eye doctor and dentist play an important supporting role. They'll spot physical evidence of damage from the dryness, but the rheumatologist is who actually confirms the diagnosis, interprets your blood work in context, and manages your long-term treatment plan if you do have it. So when you're talking to your GP, be specific. Ask for a referral to a rheumatologist, not just someone who deals with dry eyes. If your GP hesitates or says it's probably nothing, it's completely reasonable to advocate for yourself and ask for the referral anyway, especially if you have your symptom log to back up the request. You know your own body better than anyone glancing at you for a 10-minute appointment. 5. Request the right blood work, and know what you're actually asking for. This is where a lot of people get lost, because blood work sounds like one simple test, but there are specific markers you want checked, and it helps enormously to know their names before you go in. The main ones are ANA, which stands for antinuclear antibody, and it's often the first flag that shows the immune system may be misbehaving. Then there's anti-SSA, sometimes called anti-Rho, and anti-SSB, sometimes called anti-La. These two are the antibodies most specifically associated with Sjogrens, and a positive result on either is a significant piece of the puzzle. On top of that, ask about rheumatoid factor, since it's often elevated in Sjogrens even though the name suggests it's just for rheumatoid arthritis, and inflammatory markers like ESR and CRP, which show your body is dealing with ongoing inflammation, even if they don't point to one specific cause on their own. Here's something important to know going in. It's entirely possible to have Sjogrens and test negative on some or even all of these markers, especially early on. Seronegative Sjogrens is real and it's more common than people think. So if your blood work comes back clean but your symptoms and pattern are still there, that is not the end of the road. It just means the diagnosis needs to lean more heavily on clinical signs, which is exactly why the next few steps matter just as much as the blood test does. 6. See an eye doctor for a proper dry eye workup. Don't settle for just use some drops. Dry eyes get dismissed constantly because everyone assumes it's minor, but chronic untreated dryness can actually cause lasting damage to the surface of your eye over time, so this is not a step to skip or delay. When you book the appointment, ask specifically for 2 things. A Sjogrens test, which measures how much tear film your eyes are actually producing by placing a small strip of paper under your lower eyelid for a few minutes, and a slit lamp exam, which lets the doctor look closely at the surface of your eye under magnification to check for any early corneal damage or irritation caused by the dryness. These are standard tests, not obscure requests, so don't feel awkward asking for them by name. It shows the doctor you've done some homework and helps make sure you're not just handed a bottle of drops and sent on your way without a real evaluation. If the results support the diagnosis, this becomes another important piece of documented evidence for your rheumatologist, alongside your blood work and your symptom log. 7. See a dentist and say the word Sjogrens out loud, even if you're not sure. Here's something most people never think about until it's already a problem. Saliva isn't just there to make eating comfortable. It actively protects your teeth by washing away food particles, neutralizing acids, and preventing the bacteria that cause cavities and gum disease from taking hold. When your mouth is chronically dry, that protection disappears, and dental problems can escalate fast, sometimes shockingly fast compared to a normal mouth. So book a dental visit, and when you're there, don't just mention "my mouth feels dry sometimes." Say directly, "I'm being evaluated for Sjogren's syndrome and I've been having chronic dry mouth. Can you check for any early decay or damage related to that?" This changes how your dentist evaluates you. They'll look more closely for early cavities, gum inflammation, and signs of dry mouth-related damage that might otherwise be missed on a routine cleaning, and they can recommend products specifically designed to protect teeth in a chronically dry mouth, which are different from standard toothpaste and mouthwash. 8. Start managing dry mouth immediately. Don't wait for a diagnosis to start protecting yourself. You don't need a confirmed diagnosis to start reducing the damage dryness can do in the meantime, and honestly, you shouldn't wait. Start sipping water consistently throughout the day instead of chugging a large glass occasionally. Small, frequent sips keep your mouth moist far more effectively than infrequent large amounts. Chewing sugar-free gum can help stimulate whatever natural saliva production you still have. Ask your pharmacist about saliva substitute sprays or gels, and about toothpaste and mouthwash formulated specifically for dry mouth, since regular products can sometimes be more abrasive or irritating on already vulnerable tissue. Avoid things that make dryness worse where you can. That includes excessive caffeine, alcohol, and tobacco, all of which are known to worsen dry mouth symptoms. None of this fixes the underlying cause, but it protects your teeth, reduces discomfort, and buys you time while you go through the diagnostic process. 9. Start managing dry eyes immediately, and be consistent, not reactive. The biggest mistake people make with dry eye management is only reaching for drops when their eyes already feel bad. By that point, the surface of your eye has already been under stress for a while. Instead, use preservative-free artificial tears on a consistent schedule throughout the day, whether or not your eyes feel irritated in that exact moment. Think of it as maintenance, not damage control. A humidifier in the rooms where you spend the most time, especially your bedroom, can make a noticeable difference, particularly if you live somewhere dry or run air conditioning or heating frequently. If you work at a screen all day, build in deliberate blinking breaks, since we blink far less often when we are staring at a monitor, which makes existing dryness significantly worse. These habits are small, but consistency compounds. Protecting your eyes daily now is much easier than trying to reverse damage later. 10. Track joint pain and fatigue as their own separate category. Don't lump them in with just being tired. Sjogrens frequently extends beyond dryness. A lot of people experience joint pain, muscle aches, and a specific kind of fatigue that feels fundamentally different from being sleepy. It's more like your whole body is running through mud regardless of how much rest you got. Because these symptoms are so common in daily life for unrelated reasons, they're incredibly easy to write off as just stress, or just getting older. Don't let them blend into the background. Log them separately from your dryness symptoms, and pay attention to specific details. Is the joint pain symmetrical, meaning it shows up in both hands or both knees rather than just one side? Does the fatigue hit at a specific time of day? Does it get worse after activity or seem to have no clear trigger at all? These details matter more than you'd think, because symmetrical joint involvement in particular is a detail rheumatologists specifically look for when distinguishing autoimmune conditions from ordinary wear and tear or unrelated fatigue. 11. Ask your rheumatologist about medication options early, even if you're not ready to start anything yet. Once you're in front of a rheumatologist, it's worth having a conversation about what treatment options exist, even if you decide to hold off on starting anything right away. There are medications specifically designed to stimulate natural saliva and tear production for people with Sjogrens, and depending on how the condition presents, there are also broader options for managing inflammation in more systemic cases. You don't need to memorize drug names or make any decisions on the spot. What matters is asking the question directly. If this is confirmed as Sjogrens, what would my treatment options look like, and what are the trade-offs? This gives you a realistic picture of what managing the condition actually looks like long-term, helps you understand what side effects or monitoring might be involved, and means you're not starting from zero if and when you do decide to begin treatment. Knowing your options ahead of time also makes the diagnosis feel far less overwhelming when it does land. 12. Ask about a lip or salivary gland biopsy if your blood work comes back inconclusive. If your ANA, anti-SSA, and anti-SSB results come back negative or unclear, don't assume that rules Sjogrens out. Remember, seronegative cases exist. This is where a minor salivary gland biopsy comes in. It's typically taken from the inside of your lower lip, under local anesthetic, and it's a well-established, standard diagnostic tool for exactly this situation. It's not some rare last resort procedure, and it's far less intimidating than it sounds. The tissue sample is examined for specific patterns of immune cell activity around the salivary glands that are characteristic of Sjogrens. If your blood work is ambiguous, bring this up directly with your rheumatologist rather than waiting for them to suggest it, especially if your symptom pattern strongly suggests Sjogrens despite the blood test results. 13. Build a small support system before you actually need one. This one gets overlooked because when you're in the early, uncertain phase, it doesn't feel like you need support yet. you're just waiting on test results, nothing's official. But the waiting period itself is exactly when having someone to talk to matters most. Whether that's telling one close friend or family member what you're going through, joining an online community of people managing similar symptoms, or simply having someone who knows to check in with you around appointments, having that support in place before a diagnosis lands makes the whole process feel far less isolating. It also means that if lifestyle adjustments do become necessary, carrying water everywhere, adjusting your diet, managing fatigue, being more careful in dry or air-conditioned environments, you're not figuring out how to explain all of that to people from scratch while also processing a new diagnosis. 14. Book your follow-up before you leave the appointment, every single time. This is the step that quietly derails more people than any other on this list. You go in, you get blood work ordered, or a referral, or an eye exam scheduled, and the appointment ends with a vague "we'll follow up when the results are in." Weeks pass. Life gets busy. Nobody follows up, and you don't chase it either, because there's always been something more urgent to deal with. Before you leave any appointment in this process, get an actual date on the calendar for the next step, whether that's a follow-up call for blood work results, the actual specialist appointment, or simply a check-in to reassess your symptom log. Don't accept "we'll be in touch" as an answer. Ask, when should I expect to hear back, and if I don't, who do I call? This one habit alone is often the difference between getting diagnosed within a couple of months versus letting it drag out for a year or more simply because nobody actively pushed it forward. That's the full list. Catching Sjogrens early and acting decisively on that first sign, rather than waiting it out, hoping it resolves on its own, or assuming it's nothing, is what protects your eyes, your teeth, your joints, and your day-to-day energy in the long run. If you found this useful, share it with someone who's been quietly dealing with dryness and fatigue and brushing it off, because this is exactly the video they need to see.